So once a drug has been administered to the patient and it appropriately goes through the four pharmacokinetic processes of absorption, distribution, it can be delivered to target organs and demonstrate its therapeutic response. The concentration of drug that is distributed and built up at the target tissue dictates whether the response is therapeutic. Certainly, we know that drugs can be subtherapeutic, therapeutic, or toxic, and this is something that we, the nurse, need to monitor for during the delivery and administration of any drug. Some drug levels can be monitored by drawing a blood sample and monitoring what we call the titer of the drug, but not all drugs are monitored in this way, thus assessing the patient for signs and symptoms of therapeutic intent versus toxic demonstration versus subtherapeutic delivery needs to always be in our forefront of nursing care. The minimum effective concentration is an important level of blood drug concentration that needs to be developed and maintained in order for there to be a therapeutic response. This is achieved by appropriate dosing of the drug, appropriate frequency of drug administration that allow for a plasma concentration that plateaus and is maintained at what we call the MEC, the minimum effective concentration. When patients are inappropriately dosed, that would put them in the subtherapeutic range, which means that the plasma concentration of drug has not reached the minimum effective concentration. When drug levels are toxic, the patient's dosing and concentration of drug in the blood is well over what we call the minimum effective concentration. And I will draw you a graph of this when we meet in class later this week. Half-life is an important aspect of drug therapy that we need to be aware of. And half-life of a drug is defined as the length of time required for the blood or plasma concentration of the drug to decrease in half after it is administered. And the half-time of a drug dictates how frequent the next dose has to be administered. So drugs that have a very long half-life do not need to be dosed very regularly. A drug with a short half-life has to be dosed regularly throughout a day in order to achieve plasma levels that are maintained at what we call the minimum effective drug concentration. Additionally, when we meet later this week, I will go through a visual problem that helps illustrate what half-life is and how it works. When we provide medication to patients, again, the goal is to achieve the minimum effective drug concentration, not only to achieve it, but to maintain patients' blood plasma levels at that therapeutic range. In some cases, pharmaceutical companies have developed a drug which can be used in a higher dose called the loading dose that is or allows us as practitioners to get the patient's blood concentration levels at the minimum effective concentration level a lot quicker. And again, that's going to be called the loading dose. An example of this that you might be aware of is a drug called Zithromax. Zithromax is a drug that is administered over a period of 5 days for a benign, uncomplicated bronchitis. So if you've ever had a bronchitis, you may have been given a Z-Pack of Zithromax. The way to take Zithromax is to take 2 pills on the first day, and that double dose is called the loading dose. It's a way to more quickly achieve the minimum effective concentration, which is going to equate to a therapeutic response in the body. So day 1, patient takes 2 pills, that is the loading dose. Then the dose that is given over days 2, 3, and 4 is 1 pill, and we call that the maintenance dose. The maintenance dose is the amount of milligram of drug needed to be administered on a daily basis to keep the concentrations in that therapeutic range, which means we're keeping the concentrations at the minimum effective concentration level.